and today I'll be demonstrating how to change an ostomy bag. For this video, the supplies needed will be a basin, a patient that needs their ostomy changed, as well as the ostomy pouch and wafer, washcloths for cleaning, hand sanitizer for hand hygiene, scissors, a pen, clean gloves, and a stoma guide. Once our supplies have been gathered, we'll knock on our patient's door. The patient will let us in. I will close the door or the curtain to ensure patient privacy. I will then perform hand hygiene and introduce myself to the patient. Hello, my name is Pranita and I will be your nurse today. May you please verify your name and date of birth, as well as any allergies that you have. Once the patient has confirmed their identity, I will look at their wristlet and make sure that the information matches. Once that has been completed, as well as patient allergies have been completed, I will then let the patient know the procedure that will be performed today. Today, I will be changing your ostomy per doctor's orders. This procedure will take approximately 5 to 10 minutes to complete. You will be in a lying position. Do you have any questions or concerns for me? If the patient denies any questions or concerns, I will assist the patient in lying down, and then I will don on some clean gloves. Once my gloves have been donned on, the first thing that we're going to do is remove the ostomy pouch. It is clipped onto the wafer, so we just need to be a little careful and gentle. But you know that it's coming off when you hear the unclicking noise. Once the bag has been removed, we will then dispose of its contents in the basin. First, we'll have to untie the ostomy bag. And then once the contents are disposed of the basin, theoretically you would dispose of the pouch too, because you'll be replacing it with a new one, but for video purposes we're going to be keeping this pouch. The next thing we'll do is remove the wafer. So we'll gently begin to peel away from the skin. Again, you need to be gentle so we don't irritate the skin. This would be also disposed of as we would get a new one, but for video purposes we're going to be reusing this. Next, we will dispose of our gloves in the trash, and then we will perform hand hygiene. Once that has been completed, we will don on a fresh pair of gloves. And then we will begin to clean the surroundings of the stoma. We'll do this by obtaining warm water and a verified cleaning solution. Once that has been obtained, we will begin to clean around the stoma. We'll go gently. And as we're cleaning, we're going to be assessing the stoma as well as the skin surrounding the stoma. So what we're looking for is that red beefy color that indicates a healthy stoma. We're looking for any signs of infection. If there's any discoloration on the stoma, if it's a bluish purple color, that indicates that it is not receiving oxygen, the stoma is not receiving oxygen. That is something that the healthcare provider should be made aware of immediately. Little bleeding is present, that's okay. It's the excessive bleeding that points out a concern. We're also looking at the nearby skin if we're seeing any breakdown. The acidity of the feces that come out might be exposing the skin, which can cause skin breakdown. And once all is well and you don't see any abnormalities, then we can dispose of the washcloth and get a new cleaning washcloth to begin drying. Drying will go around the stoma and we're going to pat dry. Once the stoma has been pat dry, we'll dispose of the washcloth, and then we will begin measurement. This is where the stoma guide takes place. So usually ostomy pouches come with a measuring guide that we utilize. I have already utilized mine. You need to find a stoma size that is both fitting but also breathable. We can't have a stoma size that is too small. That will cause a lot of discomfort and break circulation. But if it's too big, then it does cause the risk of skin breakdown. So to measure, I did choose the 28 millimeters. This is really snug. It's a perfect fit, but it's too snug. So the next one that I chose was the 32 millimeters. And this one does fit around the stoma and does have breathing room. So once the appropriate size has been chosen, we will take our wafer and we would use the outline that's provided and place this over the wafer. We would then take our pen and draw the appropriate size, and then take our scissors to cut out the appropriate size. Once that has been achieved, we can just verify that the size is correct by placing it over the stoma, and it is correct. Before application of the wafer, we will need to apply skin prep. It acts as a sealant. Once that has been applied and it's dried, then we can put this wafer on. For video purposes, I will not be taking off the white part, just in case I need to have it reused, but we would apply the wafer on, and we would go from the inner towards the outer, just to make sure that it completely sticks onto the skin. We also need to be gentle, as this is the patient's abdomen. So once it is secure and on, then we can apply the ostomy pouch. To apply the ostomy pouch, we need to be careful because we don't want to hurt the stoma, but it will click on. You'll hear a clicking noise. Need to be gentle, as this is the patient's abdomen. Once that has been applied, I will also secure the ostomy pouch by folding in and using the tabs to secure. That way when the patient has a bowel movement, the contents will remain in the bag. Now that a clean ostomy pouch has been applied, we can clean up our workspace, and I can dispose of my gloves. I will then perform hand hygiene. I will assist the patient back into a comfortable position, and I'll have the call light in place. I will then ask the patient if they're comfortable and if they need anything. The patient has denied. I will then express my gratitude for allowing the patient to cooperate, as well as for me to give the patient the care that they need. And then I will ensure the patient has safety. I will perform hand hygiene again, and I will leave the room closing the curtain or door to ensure privacy. And I will document the procedure performed and any observations of the stoma and the surrounding skin. Thank you.